Good morning, class. So let's now have our uh, bone physiology PowerPoint lecture, Zoom lecture, recorded Zoom lecture. Okay, always be assured, class, that whenever I submit my PowerPoint presentation with video clips to our chairman, then he uploads it to your to our Neo LMS. Be assured that it will always be followed up by a recorded Zoom lecture from me. Okay, so let me now start sharing with you my PowerPoint. Okay, and let's start our lecture. Share. Okay. Okay, so bone physiology. Okay. By the way, tomorrow, let me remind you of our Zoom meeting. Let's discuss everything under the sun regarding muscle and bone physiology. Okay, prepare your questions. I would like to get to know you better also. If you want to discuss anything aside from bone and muscle physiology about the medical schooling, anything, okay, let's discuss them tomorrow. I'd like to get to know you better. Okay, okay, let's bone physiology. Okay. These are some types of bones. You have the short bone, irregular bone, and the flat bone. Okay. Okay. The bone structure. The bone is actually composed of a matrix, 30%, which are of collagen and the ground substance coming from the extracellular fluid. The collagen is the one that gives your tensile strength of the bone. Okay, yung hindi mo siya na-stretch. Okay, it's so solid, you cannot stretch it. And the ground substance from the ECF is composed of your chondroitin sulfate, hyaluronic acid. And then another component of your bone is are your crystals. Crystals, which gives its compressional strength. Ano yung compressional strength? Maski na dagan-daganan mo, hindi siya makompress. Okay, so collagen tensile, hindi mo siya may stretch, unlike your muscle. The crystals, hindi mo siya mako-compress. Okay, it is composed of your hydroxyapatite, calcium, which is your calcium phosphate. You also have in it your sodium, magnesium, and other electrolytes. So this is your bone. Okay, it's so strong uh, you cannot stretch it. That's the tensile strength, and you cannot compress it due to your crystals. Okay. This is a bone, a mature bone. With the this is your you call this is the functional unit. If the you have we call what you call functional unit. Function is composed of your haversial canal and your osteocytes with the matrix here. Okay. Okay. Bone formation begins in the 6th to 7th week age of gestation, which I hope has been lectured to you on embryology under anatomy. Okay, we have two kinds of bone formations: the intramembranous and the intracartilaginous. In intramembranous ossification or bone formation, the bone starts as a flat sheet. Okay, parang siguro if you could imagine, parang cardboard made of mesenchyme. And remember, mesenchyme um, is the structure that gives rise to your bones, cartilage, and all other tissues in your body. Okay, so if you have a flat sheet of cardboard, this cardboard is cardboard with a lot of mesenchyme on it. Okay, then some of this mesenchyme will develop into osteoblasts. Okay, So we will now discuss your intramembranous. Um, okay, so here, osteoblast. So this is your mesenchyme, which is parang flat bone lang siya. So intramembranous bone formation is for flat bones. The skull, it's a flat bone. Okay, so let's imagine your skull developing into, okay, here, there. So you have your mesenchyme, and then the mesenchyme will form osteoblasts. So halimbawa, itong mesenchyme mo na ito will form an osteoblast. Okay, so you have a lot of osteoblasts formed in the flat structure, and then these osteoblasts will start laying osteoid. What is osteoid? Osteoids are actually um, collagen fibers. Okay, wait. Collagen fibers and ground substance. Okay. Okay, so it will start forming that. Tapos, pagkatapos niyang mag-produce ng collagen and the other matrix components, it gets trapped within his production. So yung osteoblast, naging osteocytes na siya whenever it gets trapped within the matrix. Okay, so here, so these are your osteoblasts here. Nagpo-form siya from the mesenchyme. Halimbawa, itong mesenchyme na to, nag-form into an osteoblast and becomes an osteoblast. The osteoblast will start producing fibers, collagen fibers, and other matrix materials, and it gets entrapped within itself. Okay, ma-entrap siya sa sarili niyang production, and it now becomes an osteocytes. Okay, later on, these osteocytes will be invaded. So itong blood vessels niyong ito, they also come from the mesenchyme. As I told you, the mesenchyme produces muscle tissue, bone tissue, blood vessels. Okay, so they form their own blood vessels, which will supply the bone tissue. Okay, the bone tissue in the middle would be spongy, may butas-butas siya. Unlike the bone tissue here, which is called compact, talagang ano siya, dikit-dikit siya. Okay, so within this spongy tissue would be your blood vessels. Kaya iyan dyan yung bone marrow. We call it the bone marrow. And surrounding it would be your compact bone. And then on the surface of your compact bone would be some more osteoblasts, because you don't stop producing osteoblasts throughout your life, because whenever you have fractures, so yung osteoblasts nyo habang nag-grow yung bata into a teenager, adult, you have osteoblasts which will keep on producing matrix, and this matrix and these osteoblasts become osteocytes as they mature. Okay, and is it clear for them at this point? Okay, and then what is intracartilaginous bone formation? Intracartilaginous is that instead of mesenchyme, there is cartilage. Cartilage is the parang basic structure wherein bone tissue will deposit. Okay, so kung doon sa intramembranous, it's for flat bone formation like your skull, yung hip bones. Okay, intracartilaginous is for long bone formation like your arms, okay, your legs. Okay, first you have your cartilage. Okay, this is cartilage. Okay, cartilage will now, so nakasurround pa rin dito ang mesenchyme initially. Okay, blood vessels will go in. So there is cartilage here. So ano to? Like in your newborn babies, very soft, di ba? Very soft yung kanilang mga very soft yung kanilang pagkapanganak, very soft yung fontanelles, mga ganun. So embryo, pure cartilage lang ang baby. That's why nga they could talagang naka baby fetal position sila because their bones are so not bones, their extremities are made of cartilage pa. Okay? So you have your cartilage here. Blood vessels will invade them. The cartilage will deposit hyaline substance. Okay, and then in the middle, later on, in the middle, I'll show you another slide later. In the middle, the cartilage will now have calcification, and this calcified cartilage will be attacked by osteoblasts, and this will be replaced with bone. Okay, the cartilage. So intracartilaginous meaning the basic structure is initially made of cartilage, and then later on this is attacked or invaded by osteoblasts, and they ossify, or they become bones. Okay. So we have your periosteal bud here, or there, periosteal bud. Okay. This will become your spongy bone where your marrow develops. Epiphysis would be your secondary ossification center. Okay, here the epiphysis here. So your primary ossification center would be here in the middle of your long bone. Okay. And the secondary, and this will grow in length, pataas, pababa. So the baby will grow into a toddler, nag-elongate na yung mga legs niya, and then adult. Okay, so, and then sa teenager, you still have your secondary ossification center, which is found in your epiphysis here. Okay. So here, this is made up of cartilage. Okay, the cartilage deposits hyaline material here. Okay, deposits a hyaline material here. So you have a very, very soft bones, but embryonic life then, the center calcifies, okay? It is invaded with calcium, and then this calcium causes death of the cartilages here, and then, okay, blood vessels will enter here, and then attack, or this center will be have osteoblast deposition there. After osteoblast deposition here in the center and in the area here, you will now have ossification, okay, lengthening of this bone. I hear some noises. This is supposed to be a conference room. I'm alone, and yet I hear some noises at the back. Maybe they're doing something on the room beside me, adjacent to this conference room. Okay, distracted by the phone and some noises. Okay, let's go on. Okay, here. So bone growth. So this is your cartilage, okay? And there is deposition of hyaline, eventually bone. From the center, osteoblasts will be deposited here, okay? And they will invade the cartilage. So from the basic structure of cartilage, it is invaded by osteoblasts. Osteoblast deposits your calcium, your matrix, collagen, and this collagen and other matrix materials will be calcified. Calcium and phosphate will invade them. Okay, so this is your resting cartilage. Okay, proliferating cartilage, maturing cartilage, and this will be invaded by your osteoblast. And this invasion will cause length growth of your bone. Okay? So if you have the bone growth lengthwise, you have also oppositional or the width growing. So kung initially ganyan lang kalaki yung bone nyo, there would be eventual deposition of bone tissue uh, sideways. Okay, ito siya. Width. So there's growth of bone lengthwise and sideways here. There, oppositional growth. So, dadami yan. So, if you multiply this 100 times, magti-thicken yung bone niya. Okay? So, this normally occurs from infancy and as you grow older. How come we have bones which are parang mas malaki sa ibang bata, mas maliit sa ibang bata? It depends on the physical activities of the child. Kasi kung halimbawa yung bata nakaupo lang, then wala siya masyadong physical activities, then wala masyadong growth yung bone mo sideways, okay? Because whenever you put stress, stress is you put weight on the legs, then the legs will grow bigger. Okay? So this happens in athletes, 'di ba? Ang lalaki ng mga ano nila, legs nila kasi the more you put stress on the legs, you put more stress on the bones, the more the bones grow. The same way with your muscles, 'di ba? We discussed that yung tennis player, mas ginagamit niya yung right arm niya, mas lumalaki yung right arm niya because of tennis. And pag ikaw naman ay isang sprint or yung runner or you exercise a lot, your legs will grow, will become bigger, muscular, and the bone they will grow. Okay, so that's stress. Okay, so the adult bone here now is composed of your calcified structures with blood vessels here. These blood vessels will be the one that will provide nutrition to the osteocytes which have been trapped within their own production of matrix. Okay? So you have canaliculi. Meron kang transport mechanism of we have transport mechanism of nutrients to here through your canaliculi in between your osteocytes. So this is your epiphyseal plate. So this is if this is your primary ossification area where you have ossification or deposition of matrix by your osteoblast, okay? So nag-deposit yung osteoblast mo ng matrix and then it is calcified. Yung osteoblast mong nag-deposit ng matrix na trap siya sa sarili niyang deposition, they become osteocytes and this matrix will now be calcified. I-attack siya, enter doon ang calcium phosphate to ossify it, so it become harder. So this is your primary ossification center here. And you have your secondary ossification center in the epiphyseal plate. This is your epiphyseal plate, okay, in the epiphyseal area. Okay? So, dito, nagle-lengthen yung bone mo and then up to toddler, there's continuous lengthening of the bone here. And there is also continuous lengthening of bone here. So from in the primary ossification area, secondary ossification area, you have lengthening of the bone. At age 17, 18, mga ganon, 18 to 23, ossification stops. So nag-stop yung growth natin lengthwise. So we usually achieve our height at age 18 to 23 years old. Okay. Here. So ito, itong cartilage nare-replace ng bone. Okay? So here, a summary: bone formation. Osteoblasts form a membrane separating bone fluid from ECF. Okay. Um, and then the osteoblast produces soluble substances, your collagen and other substances, and then calcium invades it, calcium phosphate invades these soluble substances, so it calcifies. Okay. You have here alkaline phosphatase, which are needed for calcium exchange later, which we will discuss later. Okay. Kasi your calcium is deposited in your bone tissue. And when calcium is needed by the body, okay, this alkaline phosphatase would help in producing calcium and phosphate for the extracellular fluids. Okay. So bone resorption, if you have bone deposition or bone growth, you also have bone resorption. What is bone resorption? If you have osteoblast, you also have osteoclast, which produces proteolytic enzymes, and they would dissolve the matrix of the bones or the bone. This osteoclast produces enzymes which will resorb or cause destruction of the, hindi naman destruction, parang bang hina-hydrolyze lang, I mean, ginagawa niyang soluble yung bone para to produce your calcium, okay? So there is continuous osteoblast, osteoclast work as one grows older. So pagka nagawan na niya ng hole dito, sinira na niya yung bone na kailangan ng calcium para sa ECF or for repair lang, osteoblast will now go there and there would be new bone formation. So ito yan. All throughout our lives, we have osteoblast deposition, and then osteoclast dissolution of matrix. After na-dissolve na siya, you have osteoblast deposition again. Kasi remember, nandun lang sila sa surface ng bone. And they will now form new bone. This occurs in fractures or whenever you have injuries to the bone na parang may nasisira siya, and then new bone will always form. Okay. So there is always a balance of osteoblast and osteoclast activity there. Kumita. Wait, I'll change my... Lalong hindi ko nakita. Ito na lang, okay? So, osteoclast is activated by, actually the activation of your osteoclast is by your osteoblast. It will be discussed in more details in the next slides ko, okay? So the osteoclast will now cause your destruction of your bone tissue, which was initially medyo sira na siya, and then there would be deposition of osteoblast there. Yung osteoblast nyo will go here para, okay, so ito, osteoclast, sinisira niya itong bone. Pagkasira niya yan, kasi meron na siyang initial destruction, pagka-dissolve ng osteoclast, magde-deposit naman yung osteoblast mo into this area to repair it. Okay? That occurs all throughout your life. Okay, so ito, bone formation and resorption. If you have more bone formation than bone resorption or more osteoclast activity than bone formation, then you can have osteoporosis. If you have naman less bone resorption and more bone formation. There is less bone resorption than bone formation. Then you have there osteopetrosis, which is very, very hard bone. Masyadong matigas, okay? But if you have bone resorption equal to bone formation, then this is the normal occurrence all throughout your life. So all throughout your life, there's resorption, osteoclast, and bone formation, osteoblast. Okay, there's a balance. Osteoporosis occurs. When do you think does this occur? On menopause. Okay, there's more bone resorption than bone formation. So, ang mga lola natin, lolo and lola, whenever they fall, you see fracturability of their bones. Okay. Uh, there is always bone remodeling. So if you have, yun yung bone remodeling is actually due to osteoclast and osteoblast formation. Osteoclast activity and osteoblast formation. So if you have fractures here or deformities here, um, more bone, okay, more osteoclast activity. As halimbawa, nagkaroon ng curvature dyan because of injury, nagkaroon ng curvature dyan, there would be more osteoblast. Sorry. There would be more osteoblast deposition here and more osteoclast activity. There is osteoblast, there is more osteoclast than osteoblast activity here. More osteoblast than osteoclast activity here. So eventually you straighten the leg. See? Okay. That's how the body remodels the bone. So you have an injury, it causes deformation. There is more osteoclast than osteoblast activity. There is more osteoblast than osteoclast activity. So there, voila, they have a straight bone. Okay. Also, the strength of your bone depends on the stress it undergoes. What is stress? Stress is weight, putting weight on your bone. So if you stand up more often, then your weight is on the legs, then your legs, the bone of your legs will strengthen. Okay. You will see this in stroke victims. What happens to stroke victims? Nakahiga lang sila. So eventually, after a few months of nakahiga lang, lumiliit yung legs, di ba? Nakita nyo na yan. You will see this in relatives who underwent stroke. So ano nangyari? Dahil nakahiga lang sila, there is no weight on the bones, on the leg bones. There is no muscular movement of the legs, so lumiliit siya. So what do? Rehab for strokes. You let them stand up, you let them walk, you let them exercise. Immediately, less than 1 month, a few weeks, 1 week after a stroke, inaano na namin sila, rehab na namin sila. We try, kung conscious naman sila, we let them stand up. And then we do muscular exercises on the legs. Okay? What causes what are the hormones that affects calcium deposition? Kasi calcium yung nade-deposit doon sa ano natin, di ba, sa bones, okay? Whenever you have decreased calcium in the blood, okay? Hindi ka masyadong kumakain ng food na kukonti na may calcium, okay? This calcium is sensed by your parathyroid hormone, which is found in your parathyroid, okay? This decreased calcium now causes increased parathyroid hormone, and then this parathyroid hormone will now send a signal to your bones, and there would be an increased activity of your osteoclasts. So there is an increased bone resorption, there is an increase of calcium, and this now increases calcium in the blood, okay? So differentiate, calcium is found mostly in the bone, but calcium is found also in the blood, and this is the one that is sensed by your parathyroid. Okay, this this calcium will now increase. Okay, another thing that parathyroid hormone does is in the kidney. Okay, in the kidney, it activates the vitamin D. Okay, it activates the inactive vitamin D into the 125 dihydroxy cholecalciferol. This is the active vitamin D. It activates this, and this one will cause increased absorption of calcium in your intestines. Okay, you may take a lot of calcium, um, tablets, but if you don't have the active 125 vitamin D, it will not cause absorption of calcium from your diet. Okay? So this 125 vitamin D will increase absorption of calcium, increase absorption of phosphates. This active 125 dihydroxy cholecalciferol also increases calcium reabsorption in the tubules of your kidneys and decrease reabsorption of phosphate. And all of this here, here, here cause increased uh, calcium levels in your blood, which will now normalize calcium levels in your blood. Okay? And this now, the increase in calcium will now have a negative feedback to your parathyroid. O yung tumigil ka na, stop producing. I'm okay. Parang ganun. Okay? This will also cause production of another hormone calcitonin, which we will discuss in the later slides. Okay? So when you have achieved this, this will stop, okay, production. I naman stop it. This will decrease production of PTH. Okay? Calcium metabolism. Because calcium, bakit ba natin dinidiscuss ang calcium? Kasi siya yung nagka-calcify sa bones natin. Okay? So calcium is actually found here in the extracellular fluid. But look at that, 1,300 milligrams lang siya sa ECF. But mostly, wow, 1 million is found in your bone. So kung meron kang pagkukulang, okay, if you lack calcium in the ECF, which is detected by your blood exam, pag mag-blood exam kayo, calcium is detected, low calcium is detected, this lowering now will cause the effects na sinabi ko sa kanina. Okay? Yan. There would be increase. Kung konti ang calcium mo dito sa extracellular fluid, ano nangyayari? There is more osteoclast activity, there is resorption. Calcium will now be there. If you have extra calcium, masyadong mataas ang calcium mo, there would be more deposition in your bone. Okay? Okay, here. If you have low calcium, okay, then more absorption occurs here. And it is found here. Okay, there. If there is so much calcium, it will be taken out through the feces. If there's so much calcium, then in the kidneys, if there's so much calcium, it will be filtered out of the kidney. If there's less calcium, there is always a reabsorption in the kidney. Okay? So yun, nang-balance ang calcium natin sa extracellular fluid which is needed kasi kailangan ng calcium sa saan? Muscle contraction, sa heart, sa ating skeletal muscles, smooth muscles. So this needs your calcium. So ano nangyayari? Deposit kung may extra, resorb kung wala, kukulang, absorb kung kulang, excrete kung sobra, reabsorb kung kulang, excrete pag sobra through the urine. Okay? And the main actor of this one in the bone is your osteoclasts. Okay? There, the osteoclast. Okay. Vitamin D is very important in calcium. You saw that vitamin D is so important in the absorption of calcium in the body. You may have, sabi ko nga sa inyo, you may have a lot of calcium intake, milk, lahat-lahat niyan. But if you don't have vitamin D for it to be absorbed in the intestines, then walang nangyayari sa calcium, lumalabas lang siya sa feces natin. Okay? So initial, vitamin D, actually yung vitamin D natin, you have vitamin D in the skin which is activated by by the UV light. Okay? The UV light will activate this into your 25-hydroxycholecalciferol, and this in the liver. So the vitamin D that you take in the liver is activated into your 25-hydroxycholecalciferol. Okay? An increase of this will inhibit activation. Okay? And then from here, it goes through the kidneys. Okay, the vitamin D is activated by your kidneys into your 125 dihydroxycholecalciferol. There. And then this active vitamin D will now cause increased absorption of calcium. It also causes parathyroid hormone is also the one can cause activation of your 25-hydroxycholecalciferol. So remember this one, vitamin D here and this vitamin D are inactive. They have to be activated by the kidney to become functional. Ano yung function niya? Increase absorption of intestinal absorption of calcium. Okay? Here. So, di ba? So, vitamin D is useless. Sorry, calcium is useless if you don't, calcium intake is useless if you don't have enough vitamin D activated in your body to have it, to cause absorption. Okay? So, sometimes you don't have to take oral vitamin D. Mag-expose lang kayo sa inyong sarili sa sunlight. This activates your vitamin D in the skin into your 25-hydroxycholecalciferol. And this one will now be activated by your kidney. So, kung enough, huwag kayo masyado magsa-sunblock, okay? Kasi yung activation ng vitamin D nyo is through the sun. The sun activation. Siguro mag-expose kayo ng sarili niyo sa sun during before 10 o'clock in the morning and after 3 o'clock in the afternoon para more vitamin D. Okay? Calcitonin is found in the thyroid gland, and this causes decreased formation of new osteoclasts. So itong calcitonin nyo is the one that is active when you have increased calcium. So if you have increased calcium, you don't need the osteoclast to resorb the bone to release more calcium. So after that, it decreases calcium concentration. The action is opposite of your parathyroid hormone. Diba? Parathyroid hormone, low calcium, increase parathyroid, increase calcium. Calcitonin, decreased calcium. This decreased calcium produces increased calcitonin production, and then it decreases osteoclast activity. So there is a decrease of calcium production. Okay. Other hormones, testosterone. Testosterone increases bone matrix and calcium retention. So generally, uh, males have more testosterone than females, so they have stronger bones as they are growing up. It would increase bone size and strength. So they have mas matataas usually ang mga lalaki sa atin, di ba? Sa mga sa atin, sa females. But it also causes epiphysis. So, pero kung masyado namang marami yung testosterone mo, it causes the epiphysis to close ano, earlier than usual. Okay, so yung height, you may have stunting of growth kung masyadong maraming testosterone. Okay. Estrogen, it inhibits osteoclastic activity. So there is bone growth. Okay. It causes the epiphysis to close more than the effect of testosterone and the epiphysis. So dahil sa menopause, in menopause you have more osteoporosis kasi you have now less estrogen. Di ba sa menopause you have less estrogen? So there is now, so if estrogen inhibits osteoclastic activity, without estrogen, you now have increased osteoclastic activity. So if you have increased osteoclastic activity, you have decreased bone matrix. And then decreased deposition of calcium and phosphate kasi wala na yung matrix na kung saan sila magde-deposit. So, sa mga lola, the moment may menopause nila, increase na ang kanilang fracturability ng bone sila. Pag nahuhulog, so we have to be careful with our lolas na nasa menopausal age na. Okay. So rank, di ba? Rank is actually here. Rank is found in your this is your osteoblast, okay? Rank is found in your osteoclast, okay? You have rank ligand, which activates the rank in your osteoclast, okay? This activation of your this attachment of rank L ligand from the osteoblasts, attachment to the receptor here in the osteoclast causes maturity of these osteoclasts and activates osteoclast here. So there's bone resorption. OPG, okay, OPG is, it has the opposite of rank ligand. When it attaches to the rank here, to the receptor in the class of osteoclast, it deactivates or causes less resorption. There is no activity of the osteoclast. Okay, here. So parathyroid hormone and vitamin D causes activation of the rank ligand, and it activates this one. Okay, so this vitamin D and parathyroid hormone increases rank ligand activation of the osteoclasts. Okay, and another thing that is activated is your MCSF, and both of this, okay, activates your osteoclast and causes resorption, bone resorption here. Okay. This one has a negative activity on the OPG. Okay, so OPG, once you attach it to this to a receptor in the osteoclast, this doesn't cause maturity. This doesn't cause resorption. Maturity of osteoclast, so lessened activity of osteoclast, so less resorption. So now They are now so this is now parang sa treatment ng osteoporosis now, um, uh, they have a research here in increasing activity of OPG sa medication ng osteoporosis in menopausal women, so that there is less activity of the osteoclast, there is less resorption, there is less resorption of the bone, there is less fractures in older people. Okay? Yun ang tinitignan na treatment sa osteoporosis and menopausal women. Another thing is estrogen. Giving estrogen to pills, or we have what you call hormone replacement therapy for menopausal women, which causes less activity of the osteoclast. Nadidistract ako sa aking telepono. Okay, so anong treatment natin sa osteoporosis for menopausal women? First, we have yung estrogen, hormone replacement therapy, HRT, or medications which increase your OPG activity para less ang osteoclast activity. Okay? So here are now, I hope you have watched this video. So, di ba yung lecture ko is just a summary and integration of these ones. Okay? So class, see you tomorrow. Let's have our discussion tomorrow. Zoom meeting tomorrow. I'd like to know you better, and maybe si kayo rin gusto niyo ako makilala better through our Zoom exchange. Okay? Bye!